You've heard me say, if you can't draw it, then you don't know it. But what happens if you can't see it in your mind's eye because you don't have a mind's eye? That's actually got a name. That's called aphantasia. And I would like you to meet a student that has that and yet has become a superb student, has written high scores, and has matched for her residency. So seeing it in your mind's eye is one way, but there are other ways. Every week we have a new story, how to think about disease, how to base understanding on pathophysiology, students that have gone through our system, and in fact, other instructors and their experience with this. If you haven't already, make sure you subscribe. Hello everyone and welcome. Today we have a special treat. We have one of the handful of students that I have come to really respect and admire. And so it's my pleasure to introduce, and note how I'm going to do this, Alyssa, Dr. Makowski.
Oh, thank you.
How does that sound? No?
Really good.
We're going to talk about the pain and effort it takes to actually get what we all understand is the Holy Grail, to get that doctorate and MD degree. So I met Alyssa when my good friends, whom you've met several times, Nancy Selfridge and Eric, and she was a student in the inaugural class in Western Atlantic University School of Medicine. And I picked her up when I had to come and see the implementation of the 5th semester. And this is the story. I get there, and this is a lot, mostly about examsmanship, not about competence. And so we write the exam, and like every school, there's a screening exam you have to pass to get to write to step one, because no one can afford to let you fail step one. And so for most MD schools, that's going to be the comprehensive exam. And most schools will say 70%, because that gives you a 99% likelihood of passing step one, which is good to go. So I come in for the first semester and I meet Alyssa, and right off the top, I can tell you, this is a really knowledgeable student. So let me just start with Alyssa's story. Alyssa, tell me how you came out of sort of rural Pennsylvania, and how the kid comes from her family to go to med school. Tell us your story.
Yeah, so kinda like you said, I came from a very, very small town, in upstate New York of, like, 1,000 people. I didn't have any family in medicine whatsoever. Kinda went off to college, knew I wanted to do something healthcare related, something of that nature, ended up finding medicine, and I was like, "You know what? I'm gonna be the first person from my town to become a doctor, and I'm gonna do this and go to medical school." So kind of applying, I applied right out of undergrad while I was in undergrad. I had, like, an okay MCAT score, but it kinda just didn't have the guidance in terms of finding, like, what I need to do that's gonna make me, kind of, like, stand out to medical schools, because I didn't have anybody to kind of show me the path, so it was kind of like a path of self-forged things of, "Oh, I think I should do this, I think I should do that."
So let's talk about that. Now that you know so much more, what would have helped you along the way to know how to handle things? Like, what did you feel you lacked coming out of a background where you were the first person from your family and from your town to really play for this?
Well, I think just part of it too, like, even just looking at the MCAT by itself is, like, I had never studied for an exam of that nature, really understood what to do or how to kind of go about that, which was really tough for me. I took it during like the peak of COVID, where half the states you couldn't even be in the room with 10 other people. So I had to fly to a different state to do that. But just really the preparation aspect of it that I ended up picking up in medical school in terms of how to study for an exam of that nature, and how to kind of like keep yourself in a good mindset throughout the exam, because that is also a long exam, which I found going through step 1 and through all these comps was also an area where I struggled. I just didn't really have anyone to say, "Hey, here is what you should do," or "Here are resources you can use that'll help you with the MCAT, that'll help you kind of find research things to make you stand out to medical schools," and even the interview process.
Okay, so now you're giving advice to lots of people just like you, right? They're the first of their new immigrant families. They're families that are coming up lower socioeconomic educationally. Now they're coming into the education world. What would you tell them? How do they go about this? If you were talking to a young you, what should you do?
If you're like me and you can't find anyone kind of to reach out to, I didn't know any doctors or anyone who had been through that process before. You have your generic kind of like pre-med help at your school that's trying to do 5,000 other kids and help them do these things. So it's very hard. I think the one thing that's really picked up, I think, more since I started medical school is being able to use social media to find people to be mentors. I see all over TikTok now people that have done it and what they say they would do different or things that they would suggest. And while social media can be the bane of our existence, I think that aspect of it is extremely helpful in terms of finding areas and finding resources to help you succeed and get into medical school.
Okay, so we're building this new med site in which we want it to be a medical education community. Obviously, we're counting on you to come in and help teach. Um, should this be part of it? Should we include in our medical community, how do you break through the barrier if you haven't sort of come from a culture of how to handle this? Should that be something we should be doing?
I definitely think so. I think it's just kind of, I don't wanna say gatekeeping, but in a way, medical school is gatekeeping these people that don't have those people to look up to in those types of things, and it's not that these aren't good applicants or these people won't make great doctors, it's just they don't have someone to say, "Here's the path you should go on and exactly what you should do," and boom, you're there.
Well, I mean, just to compare, I come from a family where my mother was a librarian, and I used to get 10 words a week from age like 8, in which it wasn't just what do the words mean, it's the context and how to use them and the idea behind them. How can any kid coming out of an immigrant family compete with that? I'd been doing that since grade 5. So I know exactly what you mean. It's surprisingly hard to do because it's not something you can cram for. It's sort of a state of mind, a vocabulary. Words don't have meanings, meanings have words. But nonetheless, yeah, obviously people can help you if you get into the right milieu. Okay, so but you had a good GPA.
I had an excellent GPA. I went to a really good undergrad. It was just kind of the things outside of school that I didn't realize were very, like, so important now into getting them into medical school. I was good at school, but kind of lacking in the other areas just because I didn't know.
Okay, so you have your choice now, and I've obviously talked to lots of students over the years about this. You have a choice. You can either go to a non-prestigious school, or you can, now that you know the game, you can go do a master's PhD. Did you consider that, or did you just say, nope, I didn't play the game, I'm just going to the Caribbean?
I never really considered a master's, PhD type of thing just because I had heard that it was an option, but I feel like for me financially, it just wasn't an option. It was either you need to graduate and go get a job, or you need to get into medical school. It's not like we can spend an extra amount of money for a year of that.
We're all broke, we get that. Okay, so you decide you're going to suck it up. How did you decide which school to go to? Because they'll all take you. You had a great GPA.
So, WASM is the only Caribbean school I applied to, actually. I applied to which is crazy. I applied
I
to some
love you
US
guys.
schools, and then I had gotten an email about WASM, which is so, like, a crazy story. I had gotten an email about this new medical school starting,
You
and I was like,
guys.
"Oh, that sounds really cool, like, why don't I apply?"
You know what? I'm going to spend a fortune and I'm going to commit my life to something that's brand new. I'm not going to look at anything else.
Yeah, I mean, I had a really good pull. I have lived in the Northeast my entire life. Going to live in the Bahamas for a couple of years really didn't sound that bad. So,
So, and I bet they accepted you.
oh, yep.
Okay, so how did it feel your first year on the island?
I know everyone always talks about kind of like you're never gonna that first exam of medical school is always gonna kill you and it's really gonna like take your confidence down. I don't know if this is thankfully, unthankfully, I didn't have that experience my first exam. I feel like my undergrad really prepared me, and coming straight out of undergrad into medical school, I had all of this basic knowledge in terms of genetics, all of the things you do in your first semester that I had on lock because I had just finished it. So kind of that first exam, I was like, "Okay, this is how I study," unlike some of my classmates who had taken a couple of years off or done something else and have to get back into the routine of, "What do I do? What do I do?" Like, "Well, how do I best prepare for this?" I kind of was already just transitioning from one thing to another. So that felt really good, and I feel like the first year, at least the first semester was good. The second semester when you start getting into, like, cardio, renal, pulm, that was really quite a grind, just, like, understanding the basics and the physiology part. I feel like I was really good because that was something I excelled in undergrad, but kind of just unlike a lot of my classmates, I didn't have super clinically focused knowledge from where I had come from. So that was kind of the hardest part was like, okay, I'm learning a lot of terminology and being able to use this terminology that I've never used before. And like you talk about being able to talk medicine.
I picked you up coming into fifth semester. You were still really knowledgeable. So, however hard you found that, you were still in data clearly above average as a medical student. How did fifth semester treat you when we flipped the script and now everything is chief complaint to differential? How did that feel?
At the beginning, I feel like it felt okay because I feel like that part is what I am pretty good at is can I diagnose things? I feel like on my comps, that was I was, like, scoring a crazy percentile, like 95 percentile on terms of can you diagnose what's going on? Where I came to struggle after that was, can you go instead of going from A to B to C, can you go from C back to B to A? And kind of being able to work everything forwards, backwards, up, down. I really felt like that's where the disconnect was in terms of the way I learn and kind of being I'm very much a memorization flashcard type of person, and that's how I see things, but being able to connect those things and, like, intertwine them so thoroughly is kind of where I struggled. Like, I could go and be like, "I could tell you everything I know about this part of it," but not how it relates to another part.
Okay, so let me set the stage for the audience. WASM has a policy like everyone else. You have to get 70% on the comp to be able to go through. And I've commented, of the, I don't know, 14 or 16 that were going through, there were really only 4 that were over 70%. And most of your classmates started at 40. I mean, you can't, for me, I wasn't thinking about you as much as I was thinking, how do I add 20 points to 40? Doesn't get you to 70. But I was always aware you had trouble breaking that 70 barrier. You were always 60s.
Yeah, so I feel like it's crazy kind of looking back, but going into the beginning of that semester when you take the comp to kind of start everything, I was falling at like was it at like a low 60, 63? So that was coming in.
I looked at before this because we were going to talk. One was a 63 and one was a 65.
So coming in, I was already starting there. I was like, okay, I really just need to gain this amount. And I thought it was something like, oh, there's just a knowledge gap, something like that in terms of something I didn't know. And so I kinda went through and we had very, like, strict curriculum in terms of what we should do. You should be doing 100 questions a day, you should be doing this, you should be doing that. So kind of for the first 8 weeks or so till our next comp, I was like, "Okay, I'm gonna follow everything we do. Each day we do a different complaint or a different subject area, and I'm gonna do that, and I'm gonna go over my old questions that I missed," type of thing. This is where I start to run into the problem where I remember a lot of questions that I have seen. So kind of if I go through a question and I get it wrong, there's no chance I'm getting it wrong again because I already have it memorized in my head. It's not because all of a sudden I gained all of this
Yes.
knowledge out of it to say,
Yes.
"Oh, this is," and I could go back and say, "This is why I got it wrong." But if you gave me a question that was slightly worded differently, that doesn't mean I'm gonna perform any better than before knowing why I got it wrong. So that kind of was where I was at after 8 of the 15 weeks.
Okay, but you're still not breaking 70. Did you start to feel anxious yet?
I started to get frustrated in terms of I'm doing so many questions. I've gone through the question through UWorld and I'm not getting whatever I'm missing. So I kind of was going through everything on my exams. Oh, I only scored this on genetics and I scored this on microbiome, trying to scour where I could pick up the quickest points and where I could get myself to a 70. And so really focused on those for those couple of weeks. So then we get to week 12 or 13 or whatever, and then my score goes up a little bit. And in the meantime, I've been taking the practice exams. I'm like, okay, whatever. These, I'm getting 70s, I'm getting 70 somethings on these practice exams. I'll be fine. So then we get to week 13 or whatever week it was, we were not fine. We still couldn't just break that little barrier. It was like no matter what I did, my scores did not want to bump up any higher than they already were. So then by then I was, like, in a panic.
Well, no kidding. And so let me take you behind the scenes because I was not full-time faculty, and yet I had a certain status because it was my clinical pathologic program. So, I've taught all over the world. And so, there was a high regard for my opinion, but I was not a full-time part of the school. And, this is the inaugural class. The audience should understand. This is the inaugural class. We know every one of these students personally. I mean, there's only 16 of them, and they've been there for 2 years. So it's personal. And we're all watching with sort of appalled mortification. This lovely student is not making the cut. And they were kind enough to invite me to the school-wide discussion they had of all the faculty, administrators, and everyone going, what are we going to do about Alyssa? And it was agony. It was one of the most painful meetings I've ever been to, because we obviously all wanted her to succeed. And yet 70 was the number. But 66, that's a 96% chance of passing. Is that good enough? And everyone so wished you well, and you didn't make the cut. And what are we going to do about this? You have no idea. You're going to be facing some of these decisions in your life, Alyssa. So you can say, I've been through this. And, at the end, I was there watching, and in the end, they literally didn't know what to do. And sort of they finally, in me, said, well, what do you think? And I got to tell you, Alyssa, this is what I said. I said, 70 is a minimum score. There's something wrong here. It makes no sense that she is so knowledgeable and she can't translate this. She can't afford to fail. That's fine. Even if she's going to pass, I would tell you this. These exams aren't going away. We get exams like this for the rest of our lives in medicine. And, step one is going to be pass fail. That coming out of the Caribbean, you want a good score. That's going to be step two. A low score on step one translates into a low score on step two. There's a problem. So I would vote no. And they voted no. And you have no idea how distressed we all were. But for me, I've had so many kids and I've taught for so long. It was really, something had to be fixed. And I can only imagine the agony you went through.
So, that really sucked. I remember being at home, and at that point, I was like, "I'm not coming back. I'm not doing this anymore."
Genuine
I
anger.
felt like felt super hurt, and I felt like I wasn't I wanna say, like, I felt like no one believed in me in terms of the faculty, not that I knew this other side of it.
And it was unfair.
Yeah, I had pled my case. I know I'm gonna do well in clerkship, and I know I'm gonna have that time, and I'm gonna pass step 1, and I would just being in the clinical side of it is gonna help me pass step 1, and I think my last score is said I had a 95 or 93% chance of
It
passing.
was not 99.
At that point, I was like, "Well, what is the difference between 95 and 99? If I'm gonna pass, I'm gonna pass."
And we discussed that specific point.
And thankfully, my family, and the people around me were like, "You're not quitting. After 5 semesters of this, you're not quitting. You're gonna go and do this," and I really had to think about, like, "Am I gonna come back?" type of thing. Just, like, this felt like the ultimate failure in my life, like, I know how good of a student I am, and I know I can do this, and it just did not, like, equate to what I felt like it should have, and then it really just was tough to decide to come back, but I thankfully did.
We were as miserable as you, as hard as it is for you to believe that. The big change was that Dr. Nielsen had a miracle baby. And so, he and his wife were getting older. It hadn't happened. They just sort of said, I guess we don't. And then they had their pregnancy. And so I said to him, well, there's no way you're going to miss that. There's no way I'm going to allow that. So I will come out and do all of your paternity and make it a good big one. And I'll just do the semester. So that's what was lucky enough for me that got me back to the school when you came back. And I specifically asked you to come see me. And I can remember you sitting in front of me in that desk, and I said to you, you are just a wonderful student. And someday, when I sort of judge, how do I think about a student? I always use 2 rules of thumb, and you're welcome to use them now that you're over the hump and it's all rear view mirror. But you can use these. You should ask yourself 2 questions. Would you want them to be your doctor? And the second one is, would you want them to be your partner? And for me, that was just like falling off lag. And I told you that I would be happily have you for either, but there's something wrong and we should fix it. And you can't imagine your body language because you kind of had a chip in your shoulder. I mean, the word surly comes to mind, right? A certain hostility, resentment. What are some other good words here? It was really negative energy. And when it was clear to you that this wasn't personal, you shed all of that. It's one of the more remarkable moments that I wish I could show the audience. You just took all that resentment and you said, I'm not going to do that. I'm going to fix this. And so, it's what I tell students always in this situation. You're going to be practicing, inshallah, for 40 years. No one's ever going to care if you took an extra 3 months. It's a lot of money and it's a time, but it's mostly about embarrassment. If you get rid of that and you say, no, I'm going to use this to fix whatever's wrong, it's incredibly valuable time. And you're looking at a person who did it better than anyone I've ever seen in my 50 years of medicine. It was incredible. That's why I wanted you to share this. How did you let it go?
Well, I feel like it was really tough. I started going to therapy, which I feel like helped because I knew in myself, like I came back with that mentality, well, if no one's gonna help me and no one's gonna believe in me, then I'm gonna do it myself type of thing, which I definitely was very hostile the first couple of weeks and I'm not even gonna deny that.
I had a lot of experience with you.
Uh-huh. I was angry at the world, and if no one was gonna help me, then I'm just gonna do it, and, but I'm not gonna be happy about it.
But you found out it wasn't true, didn't you?
Yeah, but I also realized that at the same time, like, I have to find what works for me, which kind of went into the last semester thing and why I feel like I didn't succeed. The one size fits all kind of mentality in terms of the medical education thing never works. And I look at myself and my fellow classmates and how different we are in our learning styles. And I'm like, well, obviously that's true in terms of how we best pick up our knowledge. For me, doing 1,000 questions, doing 700 a week or whatever we were supposed to do was not helpful. Just because
Yeah.
that doing the quantity was not getting me anything for the time put in.
So this is when you and I were trying to talk this through, and I talked about mental images. And after I'd said that 2 or 3 times, you came back to me about a week later and said, I've tried that. I don't have a mental image.
Mhm.
And it turns out there's a term for this. It's called aphantasia. And I can remember perfectly staring at you going, well, I teach mental images. I don't know what to say.
Mhm, I just remember, "See it in your mind's eye." We're like, "Well, that's not gonna
You
work."
mean a mind's eye.
Yep.
So talk to all the people. Allie is getting all sorts of emails now with people with aphantasia. Why don't you help us all? There's a whole group of people that need you.
Yeah, so I honestly didn't realize that's what it was. I didn't realize other people don't think the same way. I've never been, like, a very artistic or visual type of person,
Now
and
we
I
know
just
why.
yeah, and I was just like, "Oh, flashcards really help. I can spatially remember where things are when you draw them, but there's no way I can go back and see the picture." I'm just like, "Oh, I remember it was up in the right-hand corner, you put something." And then kind of be able to map things out that way. But it was never like, I can see the 3D image you're talking about, flip the heart on its axis and let's look at it this way. That in my mind, that's also why I wasn't very good at anatomy, is just kind of looking at things and trying to manipulate them in your head was not working for me because I couldn't picture them in the first place.
So what did you do?
So I kind of really just had to go back to what made me successful in prior semesters and in undergrad and things like that and just make things into words and be able to understand that way. I always did really well on flashcards and I feel like I picked things up very quickly. It was just kind of how am I going to connect all of these facts that I have in my brain?
That was the great insight I had that I want everyone out there with aphantasia to try. Because obviously you and I were spending every day together. It wasn't like there was only like 14, 16 of you. I knew every one of you perfectly. And this is what the audience has to understand. So I've known this young woman for months. I've been through all of this agony with her. And, we have to solve this problem. Here's what was extraordinary. So she's done everything once and she's done it really well. You got to understand, she mastered all of this. And then she went through the complete clinical patient to disease flip in our 5th semester. She had truly mastered that. And I was watching her because I was getting her to teach the others. So I actually got to watch her brain, watching her explain things. And I was thinking about this all day, every day. And this is what I realized. If you have me draw a picture, I'm talking all the while. If you just take away the picture and you listen to me talk, you know what it is? It's computer instructions, if then. And I was watching you talk and I went, well, she doesn't need a picture. She's a computer. If A, then B. With B, look for C. Once we took me talking about a picture, your brain could do that really well. And I learned that watching you teach others because you became a really great student teacher for your peers.
What really integrated it was learning from you and looking at those pictures, but how would I explain that to myself in my head? In terms of if I was writing a textbook, what am I gonna write with this picture and how would I explain it? And I feel like that really helped me in terms of usually it's the other way around with you, like, if you can draw this picture, you can explain it. But, mine was kinda the opposite. Give me the picture and I'll explain to you what's going on in words, and I feel like that really, like, flipped a switch in my head and allowed me to start really making these big gains in terms of my knowledge and being able to apply that.
Oh, yeah? How'd your scores go then?
They went really
A
well.
little Miss Wonderful. I mean, it was shocking to me. It was like, what just happened to you? It was impressive. I can still remember going, well, I never need to think about her again. And I truly didn't. You just suddenly you were a totally, and the funny part was, once you were confident in your ability to do this, it made you cheerful and more confident. And confidence begets positive, and now everything you're learning makes you more confident. And it was like you sort of went like this. Next thing I knew, you were a giant amongst midgets. It was unbelievable. And so how'd the exam go?
It went really well. I don't
Oh,
remember
did
what
it?
I scored on that one, but I don't remember the score, but it went up, like, probably, like, 10 points or so, at least.
Yeah, so everyone should understand the other thing that we did, because this sounds like she flipped a switch and it was really easy. What happened was this, as a new school, they were having trouble getting their certification, so they were eligible for their students to write step one. So the big plan for the school was you leave the island with your step one in your bag so you can do clinical. And they couldn't do that because they hadn't had certification yet. So all of the students of that inaugural class, they go to their hospitals without step one, which means you've got to keep all those bizarre facts in your head longer. And Alyssa and I had so much fun together by this point that actually every Thursday we would meet and talk shop. And except now, of course, we're talking about someone that's got the confidence, she's got the facts. I mean, I still don't understand Andy Smith antibodies. You're the only person in the world I am convinced understands Andy Smith antibodies. Every time I see it, I go, I wish Alyssa was here to explain that to me. So every Thursday, you're seeing patients and we talk about it. Tell me about how that felt to be seeing patients, confident in your exam skills, and talking shop. How did that go?
That was really helpful in terms of kind of being able to combine them, the step 1, step 2 aspects, and clinically being able to be like, "I remember this patient. How am I gonna remember all of this other things?" And in terms of, like, the nitty-gritty of what step 1 is and kind of trying to incorporate all of that together into one disease pathology. Because obviously you do that when you learn it first, but then it's like, "Oh, this is just a disease of the 100 we learned today." And then once you actually see the patients clinically and have to work them up, it really helps to be like, "Okay, why are we doing this? And can I bring this back to my step 1 knowledge to kinda keep up on everything?" And I feel like it really just helped to be able to remember, "Oh, I had this patient and I can remember their name and I can remember everything about them," and just kind of weaving in what else was missing or what else you forgot in that little bit of time.
How did your relationships go with your attendings now that you are a master of facts and you've been handled by someone like me for years? How did the relationships go with your teachers?
I feel like really good because you pimped me enough that I don't think anybody can scare me. They can ask me 1,000 questions if I don't know it and I tell them I don't know it. I'm not afraid to be like, "Oh, I actually don't know that." But I feel like there was a lot of really good points that I remember. You have your really good diabetes management picture. That's one of my favorite things that you combined. And I just remember going to my attending, he was asking about DKA. I'm like, "Oh, let me just go back to all of this stuff." that I can just pull out and could answer all the questions, and I'm like, "Oh, that was so easy. I remember DKA used to, like, kill me, and now here we are."
How intimidated were the clinicians when you could walk through all the molecular?
They at points, they would be like, "I don't care anymore about that. We've gotten to what we need."
I don't know that anymore is what they're really saying. Well, that was actually a trick question because now you haven't got any excuse not to come when we build our teaching community. I just wanted to peg you down so you can't deny actually you can take clinical role. Okay, so everything's gone great. How worried were you about step 2 other than the fact that it would be embarrassing to plow out? But were you remotely worried about it anymore?
Not really. I feel like I had gotten to the point it was so busy in terms of applying to residency and all of the things that were going on, and it was so close to step 1 that it was like, I just gotta put on a little bit of knowledge here and there. So once you get past the hump of step 1 and you're like, "Okay, I can pass these exams," it kinda was just like, "Oh, we'll just go out there and do our best and see what happens."
How did you decide ER? So we've gone through the pain, we've gone through the grind. Now it looks like you're going to be a doctor and you get to what do I want to do? How did you decide ER?
So kind of I took myself back to the first 2 years of medical school and realized that my favorite when we were doing vignettes, my favorite questions are, "Can you diagnose the patient?" So it kind of is very nice to do the hyper acute. Here's what we're here to do. How are we going to work up and diagnose the patient? Other than that, I kind of went through clerkship and was like, I really like all of these clerkships and like all of the subjects. And I'm like, I don't know if there's any that I would be willing to give up, which kind of led me to the part of EM where you get a little bit of everything, and then having a bunch of procedures to do as well helps out a lot, and rather than just, "I'm gonna be the brain all day, let me be a brain and then let me do things." So, kind of for me, it was the perfect chaotic.
I think you're missing a huge element. I think you're an action junkie.
Well,
I
that
think
too.
if your heart doesn't pound a little bit and you feel a little sweat and you go, "Dear Lord, what is going on here? I better figure this out." I have the feeling you kind of like that,
The day's never dull. I love that
right?
part.
Yeah, because for the students that are talking about how do you know what to do, I would argue there's two problems. The first problem is watching isn't doing. So, if you're watching surgery, it doesn't tell you whether you're going to enjoy putting all those little stitches in. And the second is you're going to whatever you are and go into, it's going to make you more of that. So if you make a good fit, if you're a surgeon, these hands, you'll get into surgery and it'll make you kind of more of a jerk like that, right? But you've got to have that confidence to be a good surgeon. That's not a criticism, I assure you. So how do you know that? I would argue the key is to find people in your clerkships that you find you identify with, right? So I did pathology. No surprise when I was an intern, I would hang out in pathology because they were just really funny, happy people. So did you like hanging out in the ER?
1,000%. I feel like no hate to any other specialty, I feel like they're the coolest people. So I really like that. I would say with like a grain of salt that usually in your EM clerkship, they'll let you do the most out of any clerkship. So a lot of people fall into the trap of like, I love emergency medicine because they let me do so much. So I would say if that is you, also take a minute and be like, do I see myself doing this in 20 years, or is this a sustainable lifestyle for me? Because I feel like even though I love EM and all the things that come with it, that is part of the downfall is the burnout is really crazy there.
Gosh, yes. Okay, so how did match day feel? How did it feel when you said you matched at an institution you want to be at? Doctor, you're going into practice.
So match Monday, I literally felt like I had just gotten my step 1 result and your like heart's pounding, like and, up going up into match day, I was like, "You know what? It's okay, I matched, like, there's no way I couldn't have matched," and then that email comes and you're like, "Oh my god, what if I didn't match? Like, what?" So, it was, like, the biggest, like, thing. I literally cried after, and my dad was like, "Did you not match?" And I was like, "No, I did."
You were at home?
I was at work, but he works with me, so
Did he watch you open it?
no, he watched me, like, a minute later, he had come up to me, and I was, like, crying, and he was like, "Oh my god, you didn't match," and I was like, "No, I did," and he was like, "Why are you crying then?"
Because I'm not a guy. Yeah. But in all fairness, did he cry too?
No.
Oh, come on. He didn't have to turn away and go, "Oh, I got dust."
Yeah, I don't think he understands, like, like, how this was, like, the day of a medical student's life.
No, there's no way he could, right?
Yeah. Friday was a little, like, more kind of relaxed because it was like, okay, my biggest thing was, did I match or not? Like, whatever comes from it, I'm gonna be a doctor. I'm going into a program that I evidently interviewed at and liked enough to rank. So I said, no matter where I end up, I'm gonna be happy. Ending up at my number 1 choice was just icing on the cake right there. So Friday felt good too.
So, it's very hard to wrap your heart around this, but failure is the teacher and pain is the motivator. Medicine finds us all. Whatever you're weak in or you think you're good in, but you aren't, medicine's going to find you. And it found one of the most brilliant people I ever worked with. He was the partner that I moved across the world and changed citizenships for. It found him in his early 50s. So I don't know when it'll find you, but it will. And the question is, what are you going to do about that? And so this is why I love your story so much. I don't think you could have had this success without that failure that you resolved you were going to succeed past.
Yeah, I 1000% agree with that. Being like the youngest person in my class, it was like, okay, yeah, we're here. We're 21, 22 years old doing medical school. And then kind of going from that, I feel like that that fifth semester and the repeat there really I feel like I was very mature, but I feel like that kinda just solidified, like, this is the path I'm going into, and this is who I'm gonna be as a person, and I feel like it really just made me like, I'm not gonna give up, where the past me may have been like, "Okay, let's give up." But now it's like, I'm strong, and if you don't believe in me and no, I'm not gonna have anyone support me, well, that's okay because I don't need it, and I can do it now, and I feel like it really just made me a lot stronger in terms of my resolve and being like, I have confidence in who I am as a person and what I know and what I can do.
But it's genuine because it's been tested. It isn't some fruity song about, oh, you go, girl. No, no. This is you looked into the abyss and got pushed into it. I mean,
Mhm.
you failed. You couldn't pretend that you didn't. And now the question is, what are you going to do about it? And you turned it into success. This wasn't a you go girl toughness. This was legitimate. Look into your heart and decide, what am I going to do? It's an impressive story, and I lived every moment of it. And I was one of the people who pushed you, so I fully understood all that was at stake. And here we are, Dr. Makowski.
Yep, here we are, and it feels like a blip in the rearview mirror.
But it sure is a big deal at the time, isn't it?
And I remember you telling me this, "Once you get past step 1, it's gonna be like it never happened," and I was like, "This is my entire life right now, that's not making me feel any better." But then sure enough, I got to the point I was like, "Okay, I've been ready to take step 1 for 4 months now. We're gonna go do this," and then it was just like, "Oh yeah, of course I passed." Like, I meant to pass the entire time. So it ended up being exactly what you said, but in the moment, it felt like, "I'm gonna die, this is awful."
That's part of the reason you need a mentor or someone to talk to is it's very easy to lose perspective. And I don't think there's any better place to talk about that than second year med school. That's probably the easiest place to lose perspective in all of medicine
Mhm.
because you really think it matters.
Yep, and you're not to the point where you're seeing patients at least 3rd year, 4th year, you're like, "This is why I came into this." And 2nd year, you're like, "Oh my gosh, why did I do this to myself?" type of thing.
I want you to think through, if you got anything to say, I mean, you're a real doctor now. You've really done what everyone dreams about, and you didn't do it the easy way. Talk to your audience now. Talk to those young people out there, especially young women, and what are you going to say to them?
So I feel like part of kind of what got me into this was that anything you put your mind to, you can do. You may not have the resources to make it that way, um, but if you have this resolve and you have the dedication to do so, it doesn't matter what stands in your way or what people aren't there to help you because you can pull yourself up and you can help yourself. And then I'd also like to say that I swear if you're in your 1st and 2nd year that it does get easier and it may be awful, but then by 3rd year, even though you're working a lot of hours, you'll remember, "Okay, this is why I wanted to go into medicine. Seeing patients is really why I'm here," and as much as those first 2 years may suck and step 1 may be awful, then you'll get to the point where you're like, "Okay, I found my place and this is right."
Well, I don't think the audience has any doubt about why you've been so much fun for me to be part of your life. I mean, I've really enjoyed it. So here's what I want to give you two propositions. The first is you got to come back at some point during your residency and tell me what it's like to be a doctor. Will you
I
do that for us?
definitely will.
Okay.
Yes.
And the other is you've sort of met the team with Ali. You haven't met the engineer, but he's equally amusing. And so we hope that you will be part of our learning community project as time permits, because you think you are busy now. Madam, you have no idea what busy means till you're a resident. But yeah, as we go forward, count the audience. If you ask for her, we'll just bring her back on stage by acclaim. Keep in touch. Let us know. When do you start your first day?
I start orientation June 15th.
No.
Yep.
Okay, well, don't be a stranger and let us know how it goes.
Okay, I won't.
Bye for now. Talk soon.
Bye.
If you want to test what it feels like using this way of thinking, we've put together some multiple choice questions based on this idea of patient-centered learning and a core pathophysiology. So go give them a try and see how it works. Click the link in the description. If you're serious about building on this foundation of pathophysiology, our new textbook version 2.0 is now finally available. You'll find it linked in the description.